This is your complete, no-nonsense guide to hair transplant surgery. Everything you need to know from start to finish. We're going to cover choosing the right clinic, types of surgery and costs, what actually happens on the day, and how to get the best results from your surgery. I'm Dr. Richard Clark, hair transplant surgeon of the Growth Clinic, where we specialize in treating your hair loss with medicine and surgery. Before we get into it, you might be wondering if you're an ideal candidate for surgery. Here are some of our clients, and you can see the different types of hair loss that we treat, from thinning at the front and thinning front to back. Knowing when the right time to treat your hair loss can be quite difficult, and a lot of the times I wish I would have seen a lot of our clients much sooner. So if you'd like to speak with me about your hair loss, you can book a free video consultation with me on this page. For surgery, choosing the right doctor and clinic is one of the most important decisions that you make. This is really important as the smallest details do make a massive impact to the final results. Unfortunately, I've seen too many repair cases from other clinics where patients end up with badly designed hairlines, poor density, over-harvesting at the back, little to no aftercare, and a mismatch between what's promised and what's delivered. These are exactly the types of situations that you want to avoid because they can put you in a compromised position. They are complex and costly to repair. One of the biggest advantages choosing us as your clinic is not only our high level of expertise and our meticulous approach to your surgery, but we also prioritize your comfort and confidence in our care. If you'd like to know how we can help you, you can easily book a consultation with me on this page. So let's talk about the details of your surgery. There are two different types of surgery, FUE and FUT. The difference between these two types of hair transplant surgery is only the way the hair is taken from the back of the head. FUE removes individual hair follicles from the back of the head, where FUT takes a strip of skin from the back of the head that's later divided to create individual hair follicles. Most people tend to choose FUE because it seems less invasive, and at our clinic we use a very small punch to reduce the signs of scarring. FUT surgery is quite useful for female patients, afro-textured hair, or people who have had multiple FUE sessions in the past and still need more grafts. One of the most important things to understand with hair transplant surgery is the difference between hairs and grafts. A graft is a natural bundle of hairs and can contain upwards of 4 to 5 hairs per bundle. It's important to note that some clinics advertise hairs instead of grafts or exaggerate the total number to make it sound like a better deal. While promises of high numbers of grafts or unlimited grafts might sound very impressive, it can lead to unrealistic expectations and poor density. Most people will need at least 1,500 grafts, which costs around £5,000 with our clinic. Alternatively, we do higher volume cases around 3,500 grafts to 4,000 grafts, and this costs in the mark of £9,000 to £10,000. Before your surgery, I check in to make sure that you're set for the day, review photographs of your hairline to make sure that you're happy, and answer any final questions before the day. This ensures that I fully understand your needs and expectations, and we can focus on delivering the best results for you. We usually start fairly early in the morning, go through some final consent forms, and make sure that you're comfortable to proceed with the day. Once that's done, we usually shave the head and move on to numbing the areas so that you have a comfortable experience. We use local anesthetic, which is a series of injections along the scalp, and this ensures that you shouldn't feel any pain during the procedure. Once the area is numb, we usually start by creating little channels for your new hair. This is followed by taking grafts from the back of the head. After this, you have a little break for lunch, and later on in the afternoon, we put the new hairs in the little channels. Smaller procedures take around 8 hours, and larger procedures can take around 12 hours. Despite the length of the procedure, most of our patients are quite comfortable and relaxed throughout. Our aftercare is designed to make your recovery as simple as possible so you can get the best results. We check in with our patients on a day-to-day basis to ensure that they're confident with their aftercare. After surgery, I call our patients the next day to check in and see them later a week in clinic to help speed up recovery. Once surgery is complete, the new hairs will enter a new cycle and will begin to shed before regrowing. Usually, you'll notice some new hairs at 3 months, more hair at 6 months, and most of the results by 12 months. It's important to note that hair transplant surgery does not fix the underlying cause of hair loss, and if you have progressive hair loss, usually it's best to combine hair transplant surgery with medicines so that you can get the best results. At our clinic, we also specialize in medical treatments for your hair loss, offering a subscription service so you can stay consistent. So whether you're considering treatment now or later, you can easily book a free consultation with me today. I'll talk you through the options and give you the clarity that you need. See you soon.